Well, hello, everyone. Welcome to the final meeting that we have of the Health InfoNet Behavioral Health Information Technology Reimbursement Initiative. We're so glad you could be here with us today. And as usual, everyone has been muted during the presentation. If you have any questions for us or comments, please use the chat feature in the corner, and we will respond during our Q&A feature at the end. I do have a reminder. We have about 9 of you that we have not yet received the invoice and Milestone 5 quality report. We do want that to come into us. We want you to get paid. So you can send that to me. I have my information there. You also, I think, know how to reach me. So look forward to hearing from you on that. And taking just a couple of seconds before we start the meeting just to go over what we're going to talk about today. And it's really all about you and the great work that we have done with you in the last year. You have been such a success. And before Katie and I are going to talk about the accomplishments and results, we're going to hear first from Sean Alfreds, who is our COO at Health InfoNet. I do want you to know something I don't know if you're aware of, and Sean didn't want me to tell you this, but I'm telling you anyway because I think it's important. And that is that the reimbursement section of our HIT grant was inspired by you. It was inspired by you because you did not get reimbursed for work on IT projects that the medical doctors got, the DOs got, the hospitals got during the HITECH Act, which gave us the meaningful use piece, which allowed people to pay for a lot of IT support that you need in today's medical world. So it was Sean's idea, really, to make that better for you because he has seen the work that you have done over, I think, Sean, you've been involved since 2011 with behavioral health. And so with that, I'm going to hand this over to Sean.
Great. I'll just speak briefly, and thank you, Gemma. I look at this as everybody's idea because this was something that was vitally needed by all of us. Certainly all of you in the community. So I just want to briefly say thank you. This has been a really long time coming. It's been a dream of mine. I came to Health InfoNet in 2010 to integrate behavioral health with the general medical records in the exchange and really support your community in integrating behavioral health conversation about integrated care. So it was a lot of work. And for those of you who have been around a bit, you'll remember that as far back as 2011, NEHAF, or the Maine Health Access Foundation, brought Health InfoNet and the community together to talk about behavioral health primary care integration. One of the recommendations from that project was, hey, let's fix our laws in this state because our laws prevent this. And what do? We fix the laws. We address those state laws and allowed the exchange to participate and be able to gather data. And then we were able to work together with you all to get SAMHSA, the Substance Abuse and Mental Health Services Administration, to give us one of only 5 grants available to really start to build the systems, the technology, to allow us to be interoperable with behavioral health EHRs. And then that was followed up by the SIM grant. And we were fortunate enough that our state government wrote one of these testing grants and was awarded one of these testing grants. And to my knowledge, we're the only state in the country that was awarded a testing grant to give dollars back to the community to help you all with the resources you needed to integrate and to develop workflows where you could use data, to spend the money on your IT systems, which you weren't getting, as Gemma said, from meaningful use. So this was a lot of work, and while Health InfoNet has been involved, the heavy lift was on your behalf, and we know that, and we're extremely grateful that you've been with us this whole time, extremely grateful that you've believed in us that we could do this, and extremely grateful that you've continued to participate in these efforts. And I can just say this, we're not stopping here. I still think we're just at the beginning, and we're gonna bring forward more resources. I don't know what they are yet, but we will find them. So with that, I'm gonna hand the mic back to the team, who's done an awesome job as well in coordinating these efforts and just really making you all stand out nationally as being true innovators in this space. So thank you very much.
Thank you, Sean. Really appreciate it. So now this is really an exciting piece for Katie and I to present on, and this is the accomplishments and results that that you have achieved over the last, since the last 4 years. So first I wanted just to throw out this number. We did have behavioral health organization HIN users in 2014, and the number of users were 9. We had 9 users in 2014. Now we have 265 users. That's a big jump, and that's a lot of work in a short period of time. In fact, those users have actually gone out of their way. They've actually doubled their usage over the last year. They went in this past year 47,029 times. That's a big number. And those high numbers just didn't happen. Those numbers happened because of you. You had purpose, you had intention, and you made it happen. It wasn't easy. It was a heavy lift, as Sean said. First, you had the HIT challenge. You had to work with your IT department, work with our IT department, work with your EHR vendors. You had to build interfaces. You had to send HL7 data. It was a heavy lift. And then if that wasn't enough, we had the consent challenge. Remember that? When you had to roll it out across the agency and explain consent to your staff and then have your staff explain it to your clients. But you did that. That was a heavy lift. You did that. The clinical portal challenge was part of it as well. Your IT staff had to make sure that all of your staff had access. The passwords were in place. They were able to get in. They needed to know how to use the portal. You had to set up training. This was another heavy lift. And then that led directly to the staff resistance challenge because that was there, and a lot of them didn't want to go into Health InfoNet. They didn't want another change. And as one of you said, maybe it was too much change at one time, but you went forward anyway. And as if that wasn't enough, we gave you another one, and that was the QI challenge. We shared this. As part of the SIM grant, we had to do a quality project together, and that was another heavy lift for us. So how did you meet these challenges? You did that by providing leadership. Now, this is an interesting piece because often when you have IT initiatives that then move to the clinical piece, that often is disconnected. It doesn't happen. It stays in the IT department and it doesn't move, but you didn't let that happen. You took leadership and you made it a clinical priority. And because of your leadership, people started using the clinical portal, people on your staff. And here's some numbers that I'm going to hand over to Katie to talk a little bit about what has happened when your staff uses Health InfoNet.
Sure. Thanks, Gemma. Hi, everyone. Good afternoon. This is our final SIM webinar, which is kind of hard to believe, and you guys have accomplished so much. So we have the next few slides are some statistics. It's all of your work that you've achieved over the last 4 years in numbers. Sometimes it's fun to see it that way. So if we add up all of the patient record accesses that your staff, just within the SIM grant project here, have done, you've accumulated almost 75,000 records accessed. So that's fantastic. As you know, we've been tracking that monthly usage over, and I have a slide that shows the change in climb of usage over the life of this grant. We'll show that in just a minute. Of the patients that you are managing within the portal, on average 12,000 are signed up for notification alerts or ADT alerts. A lot of you are using emergency department admission and discharge notifications, hospital admission and discharge notifications, as well as new lab results notifications. As you all know, you're very focused on diabetes and HbA1c evaluation, making sure patients have that. You're doing all of that within this notification service we have. So out of all of our, on average, 260 users per month, 163 of you are using the notification service, which is a huge number. That is very different than what we see in comparison to, let's say, primary care users or other industry users. So the fact that you've understood that service, how to use it, and figured out the value in your workflow across your user base is phenomenal. So congratulations on that. And now we're capping out at average. We've seen consistently over the last few months at approximately 260 unique users per month using the system. So it's really amazing usage. And on top of that, we've been able to pay out at this point, and this is still in progress, but at this point, $1.455 million across everyone together under this initiative. So well done, fantastic. So in addition to that, as we all started, part of the requirement was that, if you remember way back, we did an RFP to have folks tell us about your organizations, your IT infrastructure, because more than 20 organizations wanted to be a part of this initiative. At the time, we only had enough room and funding for 20 positions, and we had to cut it off somewhere. So you participated in that competitive process. And at the time, the behavioral health home model with MaineCare was brand new and was just starting as well. And at the time, we weren't sure how many organizations were going to participate in behavioral health homes, but we knew that we wanted to align this initiative with the behavioral health home model of care because it all fits together so nicely. So what has happened over time is that as the organizations in our initiative have joined the behavioral health homes, we've seen a lot of synergy between those initiatives. So at the end of the project, 18 out of the 20 actually joined the behavioral health home initiative. So that's fantastic alignment under the SIM goal. And in addition to that, in SIM year 4, for those of you that may not be aware of this because you're already participants, we had an initiative that supported additional behavioral health home organizations to join Health InfoNet as a view-only client. For those clients that are not able to share data from their EHR, they have technical constraints around sharing data, but they did want to log on to view medical information and benefit from having access to all of the medical KeyPro additional data sets that are available in the clinical portal, as well as implementing notifications. So since May, when this offer was released, we've had 6 new behavioral health homes join Health InfoNet, and one of those actually is bidirectional and sharing data, which was a bonus. We hope that there's a handful remaining of behavioral health homes that are not yet connected to Health InfoNet, and myself, Katie, and others here will continue to support the Office of MaineCare Services to collaborate with those organizations to make these tools and services available to them. So if you are talking with your colleagues and they have any interest in joining and they haven't yet, please, you know where to reach us. Please encourage them to reach out to us and talk to us, and we will follow up with them. Also, as part of SIM Year 4, we had a new data capture project that is also the first that we know of in the country, which is for MaineCare to release and share mental health information that is coming as a result of their prior authorization workflow that happens with all of you. So in Maine, our vendor is KeyPro, and as of May 1st, we have been live with this prior authorization registration certification. I know it's not just prior authorization data. With this information for patients that are participating in behavioral health homes. So we get updates of that information on a daily basis, and it's allowed us to obtain some mental health data that is not available via any other means for those electronic health records that can't share data at this point, and also for hospitalizations and other events of care that Health InfoNet is not obtaining via any other means. So this has been a really important, critical, additional data set that supports the team effort for care coordination between behavioral health homes, primary care providers, emergency departments, hospitalization staff, et cetera. So that's been really fantastic. So as I said, we hope to continue all of this work. All of the contracts continue as SIM comes to an end. And if folks have any questions about ongoing work or new work, please, again, reach out to us. That's that final data slide here is just showing the growth from the beginning, which is back in May of 2015 is when we had our first users get authorized access. We spent the beginning of them working on our very long participant agreement contracts and business associate agreements, and then we went into the heavy lift that Gemma talked about, the consent education, which took months. So it took a long time to get all the contracting in place, the notice of privacy is in place, but once all of that finally happened, the folks that were leading the way started accessing the system in May of 2015. However, it wasn't until the beginning of 2016 that really all organizations had users that were authorized to move forward with access, because there was a phased approach for those that were ready with the consent model. So you see this big jump at the beginning of 2016, and then since then, when you had your quality project and then you've continued on, it's been a steady increase month after month of new users and additional patients accessed. So the patients have topped off at about 5,000 for any given month most recently, and we've seen that number come back up in August. Sometimes with vacations and seasonality, we see some slight seasonality, but that's normal compared to everyone else. And we hope to see this trend continue. Gemma, why don't you go ahead to the next slide, and I'll just transition back over to you, but I want to say just a few words before I do. I want to say congratulations to Gemma and all of the staff that you have assigned to participate in the many interviews, presentations on these webinars, and really critical thinking exercises that you all have done to help us learn about the qualitative experience, which really does lead to a quantitative improvement in patient outcomes. Unfortunately, we don't have 20 years to study longitudinal patient outcomes. I would love that if we had that. Everyone knows that's my dream. But you and I know both, as well as Gemma and everyone else that works on this project, that truly patients' lives have been changed as a result of this project. We know that, and Gemma knows that, because this is our 25th webinar. You all have done 45 presentations at our request and encouragement of your own volunteering, and all of the preparation that went into that, Gemma has worked tirelessly on over the last 4 years. And most recently, she's done 29 staff interviews to really hone in on the very specific staff roles and positions that you employ that support care coordination and patient management with our tools and services. And Gemma will say a little bit more about this work she's been doing. But the amount of reporting and time that you've given has been fantastic, and we really, really appreciate it, and we can't thank you enough. So Gemma, thank you. It is also Gemma's 7-year Health InfoNet work anniversary tomorrow. I just have to say that. So since 2010, she has been really focused on bringing the value of these services to the behavioral health community in Maine. So with Sean's vision and Gemma's passion, it has been fantastic. So thank you, Gemma, and I will turn everything back over to you.
Well, thank you, Katie. It has just been such a privilege working with every one of you, and we will be more coming. But just briefly, as we've been going into this data set that we have based on all of the good work you've done and you've shared with us, one of our biggest surprises was the real leadership that is shown by your nurse care managers in the arena with the behavioral health homes and your collaboration with primary care providers. They really reach across the aisle, and with their leadership, the health home coordinators with them, you actually are integrating behavioral health care and medical care out of your offices, which is really, which is new. One of the things that stands out to me in some of the research I've been doing is that so much of the literature is about integrating behavioral health with medical, having them co-located is a big model, very popular model. In the state of Maine with the behavioral health homes and the medical homes, that is not the model. It's not to be co-located. And so they kind of then say, okay, well, then that's a coordinated care model. But I think with what your nurses do and what your health home coordinators do with real-time data is you really make that more than a coordination piece. You make it an integration piece. And there's a lot of work that you do with the primary care providers on behalf of your clients to get them the care that they need, that the PCPs want them to have, and that they're very grateful to you when you move forward and work with them too. So that was a really, really wonderful thing to discover. I think we are the only state doing something like this, and that's an important piece. You're pioneering it. And we will be telling your story. I learned years ago as a social work student, if you don't write it down, it didn't happen. And all of the work that you have done happened. So we are writing this down, and when our report is ready, we will be sending it to you. But you have made such a significant difference in the lives of your clients. We think that story has to get told. Now, I told you it was a surprise. In all of the follow-up work that I've been doing and talking to the 29 staff that I did with interviewing, what wasn't a surprise was the top 10 interventions that we had identified by our work with you a couple of years ago, coming out of your work using the clinical portal, remains intact. These are the interventions that your staff does continue to employ day in, day out, around the clock. And so when you look at the number of patients accessed and realize that this was happening one client at a time, one intervention at a time, this is granular. You do this every day, day in, day out. This is what you do. But it adds up. It adds up, and it makes such a difference. So now we're going to get to our $1,000 question. Just because those 10 interventions that you do in a timely way using real-time data, can that reduce ED visits? When your panel is filled with high utilizers with SMI. We did a quality project together. It was a big lift. 10 real-time HIE data plus your clinical interventions reduce the ED visits for SMI patients at high risk of ED admission. Big question. Our original project, we studied this for 2 6-month periods, one without the clinical interventions using HIE real-time data, and one with. That was the quality project that we did. And for the SIN Year 4 extension, we extended that for 2 12-month periods. And what we're going to be doing, our deliverable, is, did that make a difference? Good question. You think, oh, yeah, it's going to make a difference because it makes sense that it would make a difference. But you know what? It wasn't a slam dunk. According to previous studies that I've been looking at, it's difficult to reduce ED visits when your clients have SMI and they're frequent users of the ED, and that was what made up your panel. So this was not a slam dunk by any means. So on this cliffhanger, how did we do? I'm going to hand it over to Katie to let you know.
Okay. Well, the news is that we did fantastic, and I just have 2 data slides here that really reflect a huge amount of work that we've been talking with you about today. So what we did is we expanded the analysis to the year prior to having access, or I should say not access in totality, but in terms of having broad access to Health InfoNet and targeted use with the notification service for your patient cohort. So we looked at, of the patients, and there's 418 specifically in this data analysis across 20 of your organizations. You all know the history, but to restate that for anyone who's new on the call today. Out of those patients, so we're talking about 418, in 2015 there were 3,382 ED visits statewide for that population. And then when we look at 2016, so these are calendar years, 2016 we see 2,586. So we see this as a 23% visit volume decrease in the raw numbers. So that's fantastic. That's a large percent in a short period of time for a very chronically ill population that is very difficult to work with and manage. So next slide, Gemma. So a little bit more analysis of this patient cohort. 70% of these patients, which comes to 288, had decreased patient visits. So the vast majority, more than the majority of patients that you worked with, we saw a decrease in ED utilization. That means that what you're doing and what you have continued to do since then has been very effective for the majority of patients you've worked with. We also know that not all patients can change. Not all behaviors can be changed. There's lots of complicated reasons around that, as you know, and for a small percentage of these folks, 8%, there was no change in utilization in the two-measure period before and after. And then there was a small percent, but significant, 23, that had an increase in utilization. This is not, I don't think this is surprising to folks in the field that do this work, but it's an important story to tell and point out that no matter how much technology and data you may have access to, not everything can be impacted and changed with technology. But on the other hand, the majority of the patients you are working with have had a positive and a significant change in their care. And hopefully what that means in their lives is they're getting more appropriate care and avoiding unnecessary care like ED visits and hospitalization. So well done. This is very positive information. And I guess the last thing I'll say before I turn this back over to Gemma for wrap-up is that I will be working with Sean here around creating more materials that give a more in-depth explanation about what we've seen here in the data. And we hope to use it for future grant requests, for dissemination of information of all the work that you all have done nationally, because this is in high demand. This information and the data behind our research is in high demand. And so it doesn't stop here, and we will be using it. As we do use this information and go forward, we may be reaching out to you all to give you credits and any materials, and to let people know that we'll be giving you all recognition, all of the organizations that participated in this work, as our thanks to you all. So that's really it for our results, and I'm going to hand this back over to Gemma.
Thanks, Katie. I don't see any questions coming through chat, but give you a minute to maybe just go ahead and put a question in. And while we're doing that, though, to really give our thanks to you. I wish this was $1 million that we were giving out to you, but it's our little certificate of achievement. And you really, truly are pioneering medical behavioral health integration using HIE, and it is a story that will be of interest across the country. And so lots of thanks so much to all of you. We're not going away. We are still your healthcare partner as we move forward. We've got your back, and we look forward to our continued work together. And you know where to reach us with any questions. And with that, gosh, a huge thank you, everyone. And you will be hearing from us, and we look forward to our continued work together. Thank you.